Thank you everyone for joining. As I mentioned before, we have six courses that we're going to cover, and only an hour. So I'm just going to go ahead and get started. I am recording this, so we will be sure to post this and have the Tulane School of Public Health comm team make sure that this goes out to everyone in case anyone is not here, and any of the course directors would like to share it with prospective students. With that said, I'm going to go ahead and jump right into it. Hi, everyone. My name is Robert Palestina. I wear a couple hats at the School of Public Health, one of which is with the Office of Global Health, and I support and oversee a lot of our international programs that we offer. So this is the first time we are hosting a virtual study abroad fair now that we have six different summer course offerings for 2026. Five of which are international, and one is a domestic off-site course as well. All the course directors, except for one, are here and will be able to give you more information. But before I pass it off to the course directors, I'm going to do a little overview on kind of the specifics of what is consistent between a lot of the international courses. And granted, some of this might vary. Some will vary from course to course, but these are a lot of the consistencies. So I'm going to quickly go out over a few of those items before handing it off. Okay, so first and foremost, course fees and registration. So just as any other course, you will register through Gibson. Now, you will see that a majority of these courses, I do want to bring your attention to the screenshot below from Gibson. This is of the Cuba course. You will see approval. It says instructor approval required. A majority of these courses will have that, meaning you are unable to register for the course until you receive that approval. So this is for both you and the course instructor. So if approval is required, the student or instructor must forward the approval email with both the student Tulane ID and 5-digit CRN to Tanya Durden. Her email here is on the screen, and she will be able to remove those permissions for you. So you would be able to go ahead and register for the course. Again, this is all done through Gibson, just like any other course. Another thing I really want to bring your attention to is the course notes. So you really need to be mindful of each course's final refund deadline. This will vary by each course. So as you can see down here where I have circled in red, please read those carefully if you're interested in applying and registering for the program. These are the dates which you will get a refund on the course fee. Each course does have a course fee that varies, and what it includes varies between course, and more of the course directors will have more information on that. But please read through the course notes and just understand the different deadlines that each course might have in order to receive refunds. Logistics, health, and safety. So booking travel, all students will book their travel independently. Obviously, we'll coordinate this between or with the course director in terms of the airport, the travel dates, and all that. But students are responsible for booking flights independently. A majority, I think, if not all of the course fees that you will see do not include flights. So just something to keep in mind. And all Tulane students, this is a university-wide policy that they must book centrally through Concur or World Travel. That is found in Gibson. So you'll be able to centrally book through World Travel or Concur. So the reason behind that is Tulane offers Crisis 24 emergency support. When students enroll through or book their travel through Concur, they're automatically enrolled in Crisis 24. This is in case any emergency issues happen while you're on site, abroad, and there is an app with support that they're there 24/7 to assist. So this is a very important emergency support service that Tulane provides. And when you book through Concur, you're automatically enrolled in that. Starting in 2025, Tulane also now offers international medical insurance for free. This is provided to all individuals traveling abroad for Tulane-related purposes. So you will automatically be enrolled in health insurance, supplemental travel insurance, if you are participating in traveling abroad on one of these international courses. One small note, if you are traveling after the program or before the program independently, this insurance you will not be covered by insurance. So please make note of that. Lastly, once you have registered for the program, for the course, you will be followed up to apply online to the course. So there is an online application that is facilitated through Teradata. This is where you will provide your emergency contact. It's where you will provide your information. You can upload your passport, your flight itinerary. It's just to ensure that we have everything central, and we're able to access it if necessary. So it's a very simple online application that we will follow up with after you have registered for the course. And finally, pre-departure preparation. So each course will hold its own pre-departure meeting. So you will be clued in into all of the logistics, everything related to cultural mobility within the site that you will be visiting, or rather traveling to for the course. So please, you will hear more information on that from your course director. In addition to that, all students must complete the School of Public Health pre-departure orientation. This was newly launched last summer as well. It is a Canvas module, and you will receive access to this after you have registered for the course and prior to your departure. So these are all of some consistencies between all the international programs that we offer. And we will have, I didn't mention that we plan to have a question and answer after everyone has presented. So if you have any questions about this, I'm happy to follow up. And I also provide my email at the end as well if you have any further questions. So with that said, now we've got that all the way, I'm going to pass it on to Dr. Nathan Morrow, who will present on the Italy course. Oh, I'm sorry. Dr. Castro was unable to make it, and I said I would present on her behalf. So we're going to start off with the Cuba course. I am not an expert on the Cuba course, but I said, like I mentioned, I'll present on her behalf. So I'm going to quickly go over some of the details of her course. So forgive me, I might just read off of some of these slides. Dr. Castro is happy for you to contact her for any further questions. But right now, I'm just going to do a quick overview. So this Public Health in Cuba course, it'll be going from May 25th to June 5th. This will be in Havana, Cuba. And as I mentioned, the course director is Dr. Arachu Castro. So what you'll study and what you'll experience, it will focus on how Cuba prioritized strategies to achieve universal health care over 6 decades, with emphasis on primary care and integration across levels of care. Public health programs focus on infant mortality prevention and infectious disease control, plus the economic political context. Site visits to site visits are to health facilities and community organizations. Eligibility, it must be a graduate student in good academic standing. From what I understand, Spanish is not essential or not required. Translations will be provided, but obviously Spanish fluency is an asset, and it's recommended that around 3 years of college level Spanish or being a heritage speaker. Travel is approved only if degree seeking and credits count toward the degree. Students must not have graduated by May or June of 2026. Costs and what's included. The course fee for this course is $2,500. Housing will be at Casa Vera, which is with double occupancy rooms. The course will include, within the course fee, includes 2 meals per day. That is breakfast and dinner, as well as a farewell dinner. That also includes visa fees and tours and outings. What this does not include is airfare, transportation to and from the airport, incidental costs, extra expensive. Another note is Cuba medical insurance. There is coverage that is included in ticket price for flights originating from the US. So this would be on top of the 2-lane provided travel health insurance as well, but something to keep note of. How to apply, next steps. So as I mentioned before, all registration will be done through Gibson. And again, these deadlines will vary between course. So registration closes on February 19th. As far as refunds go, full refund of the fee if the class is dropped on or before February 16th, 50% on or before April 15th. So this is unique to the Cuba course. Approval does require passing an in-person pre-departure quiz. It's multiple choice based on syllabus readings that will be administered during the week of April 6th. So cancellation policy, it is possible due to political instability, severe weather, government travel restrictions that this course could be canceled. Even after enrollment. So if canceled, students will still receive a full refund. And here below is the contact information. If you want to reach out to Dr. Castro for more information on course content, please reach out and give her shoot her an email. Anything related to registration and deadlines, you can contact Gail Marie, who is with the IHSD department. So she will be happy to help you as well. So those contacts are available. Please reach out. And now that is the end of the Cuba course, and we're going to
And
move
this
on.
is, sorry,
I'm sorry.
Robert.
No,
This
go
is
ahead.
Gail Maria Bass. I'm just wanted you to know that I'm on the call too. So if you have
Oh,
questions,
great. Great.
yeah, we can ask.
Yeah, great. Gail Marie's on the call, so when we get to questions and answers at the end, she can help with more Cuba course related items. Great. And I'll pass it off to Dr. Nathan Morrow.
Hello, everybody. So yeah, this is Nathan Morrow, and I've been bringing students to study food systems and food security in Italy for almost 20 years. Can we go to the first slide? And so the current food security and resilience course, um, we we use a number of different ways to examine how globalizing food systems affect food security and nutrition around the world. And this starts everything from, individual nutrition up to international level policy. Most of the course is seminar discussions based on the core readings and interactions with experts that come in and give guest lectures. We do some case studies, but a large part of the course is actually field visits to Italian producers. We also meet with experts from the UN and other international organizations, actually the US mission as well, in Rome to talk about what the most current food security issues are around the world. And this is all put together to give you a set of tools and approaches to analyze food systems and their sources of resilience, and then looking through a few different lenses on what can affect that, such as gender, climate change, and governance. Yeah, and so it's two locations. We start out in Rome and then move to Bolsena, Italy. Next slide, please. So most of the course takes place in the province of Lazio, which is in central Italy. We start out in the middle there in Rome. And then as you move up to the corner by Umbria and Tuscany, there's that second lake, which is Lake Bolsena. So we're out in the countryside in a typical central Italian village on the lake. And we've had this local partner who has a 17th century convent that we have exclusive use of as our campus. And so we usually stay there in the mornings for seminar, book discussions, expert lectures, and then in each afternoon we pretty much go out on a field visit. Next slide. So starting out in Rome, you may know this, but the UN system and most international organizations that deal with food security, agriculture, and food-related humanitarian response are based in Rome. And that's kind of has a long history because international food trade basically started in Rome over 2,000 years ago. And so we look at the role of Italy and Rome and the overall development of international trade and food and the policies that facilitate that and how the world comes together to harmonize policy around food security and agricultural trade, and the effects that has on nutrition and food security. We visit World Food Program, which is the largest humanitarian organization in the world, and also Food and Agriculture Organization. Again, the central scientific and policy convening organization of the UN. We visit some other organizations too, including the U.S. mission, which is the largest U.S. Mission in the world in terms of the amount of money that they give. The United States has always been a very large supporter of food security around the world. Next slide, please. And the field visits are primarily to producers. So this class is for people who really like to get out in the field. So in the morning, we look at concepts and different tools and methodological approaches to study food systems and systems in general, actually. And then in the afternoon, we go out and explore the Italian food system. So going to organic producers. A lot of them have their own very special approaches to organic food production, biodynamics, all sorts of permaculture and interesting, innovative approaches to organic food production. We do visit a number of other like cheese producers and other farms that have animals on them as well. So it's a particularly good class for people who like animals, or even for people maybe who have never visited a farm and want to actually get a good perspective on where food comes from. Next slide. We don't just focus on producers, we also look at the transformation of food. So we learn about traditional and modern cooking approaches, food preservation, food safety, and then spend a lot of time. And actually, most of our field visits include a meal because it's hard to study food without actually eating it and tasting it and discussing it. So we spend a lot of time around the table doing that, traveling around central Italy to some of the best producers in the area. Next slide. So the dates are from June 1st to the 12th. We ask that you come a day early on the Sunday, and we do cover accommodation that night. And then we actually cover the accommodation on Friday too, if you want to depart on Saturday. The class ends sort of mid-afternoon on the Friday, the 12th, but we do cover accommodation that night. We cover all the transfers from the airport. We're planning on having a pre-departure information meeting. We're sort of thinking the 29th of April. New puppies. And yeah, and then we'll go over all of the extra details in that pre-departure meeting. You can always write to me too as well if you want more information. Next slide. So we do have a $2,500 course fee. We try to make it very inclusive. So we cover all the accommodation in Rome. It's usually shared rooms. At the Bolsena campus, it's individual rooms, but there are some shared bathrooms. We try to cover 3 meals a day. We do have a couple free afternoons off, especially like on the Saturday and the Sunday, where you can get a meal at a restaurant in town or a picnic as you wish. We do all of the local transportation and any entrance fees to any of the exhibits. We don't cover flights or personal items. And then I always get travel insurance, and especially if you're staying on longer in Italy or traveling around Europe, I'd suggest getting your own personal travel insurance to supplement what Tulane gives you. But we really do try to do a good job of covering all the expenses that are related to the course. Next slide. Yeah, so please call or actually write me, and we can organize a Zoom call if you'd like to hear more. We can talk about the course and some of the field visits, make sure everybody it's within your interest area, and then we can remove that restriction on the registration. And we do have a maximum class size of 12, so it is a limited, mostly so we can just have really good interactions with the experts and on the field visits. Anyway, please contact me with any more questions, and I'll pass it back to Robert.
Great. Thank you, Dr. Morrow. And we're going to keep things moving along.
Okay, hello all. I'm Dr. Valerie Pasoldan. I am tropical medicine and infectious disease based in Lima, Peru, permanently for the past 25 years. Our course is in mostly the Peruvian Amazon, but it starts in Lima and it ends in Lima. The course date will be May 13th through May 29th, so it's about 2.5 weeks. Next slide. That's a picture of the Amazon. Okay, next slide. Okay, so as I mentioned, I've been based in Peru for a long time. I'm a social scientist working on a lot of infectious disease projects like dengue and Iquitos. So I bring kind of an intersection of different disciplines into the projects that we will be involved in and visiting and talking about. And I also have collaborators that I've worked with for many years on the ground who will be part of giving the guest lectures and speeches. Okay, next slide. So again, May 13, May 29, it's a 3-credit course, 14 class days, but 18 total days on the ground. And it's open to students in any department. There's no prerequisites. It would be ideal if you speak Spanish, but last year we had one who didn't, and we translate on the spot for that person. Next slide. And we do a variety of things in this class. For example, we visit different health facilities, primary level health, hospital level. We go to a community mental health hospital, and we start mapping the health systems resources and look at how social determinants impact health outcomes in a developing country. We discuss ethical issues and power asymmetries in global health and strategies for overcoming them. We look at how the different research questions we have, especially because, again, I'm doing a lot of work that is intersection of, applying social sciences to infectious diseases, but then also collaborating with people who are entomologists, epidemiologists. And so we will discuss how these are all integrated into the different research projects that we do, including the very community-based and community mobilization that we're doing for dengue risk reduction. Next one. These are students from last year, and there's Lizzie who's in this meeting. What we won't do is I'm not going to try to shove GIS mapping in 1 hour when we have entire semesters of this. I want to really spend as much time as possible in the field, getting out every day. At least, usually we're just spending most of the time outside, and then we're reflecting on the class during lunch, during breakfast, during dinner, but just really completely immersed together in what is going on. So we do have some office time, but really we're trying to get out there as much as possible so that we can talk about it. The other thing is, after working in Peru for 20 years, I also have colleagues and contacts in different settings. So I often try to really personalize it. So even though I do a lot of like implementation science, community mobilization, I have a colleague who might be able to help with the taxonomy and larval habitat and collecting mosquitoes. But we can also, like, somebody last year was very interested in mental health. So we added that component because I'm able to just make the connections and make that happen. So we will try to do focus on students' interests, but again, really kind of keeping it hands-on in the field. Keep going, next one. Again, I've said this, May 13th through May 29th. We are off on weekends, or it might be Sunday and Monday. So Saturday, we can do some of the community work that happens on Saturdays. Combination of lecture, hands-on, what I've already mentioned. That's one of our students last year in her suited up. Okay, next one. Estimated cost is $2,500. Like most of the courses, you need to get yourself to Peru and buy also the ticket to Iquitos. But basically, the cost covers hotel, the hostels that we stay at. Last year, we were able to have everyone have. Depends on. We probably will have double rooms, which will shave some costs. But it costs the boat travel, ground travel, breakfast and lunch, and then some group dinners, speaker honoraria, etc. So it's an estimated cost about total $3,500, but the $2,500 is for this specific course. This is a brain museum that we went to see that has a lot of different, strokes evidence, but also neurocysticercosis. Okay, next one. Said that again, so I'm not going to repeat it. We do have a maximum of 20. I think that will be a lot, so I don't think that will be an issue, but we do need a minimum of a certain number of students. Next one. So I think the dates are going to be pretty universal for all of us, so that I will let you guys check in, but here you can read it yourself. The dates, full refund if applied before 15th of February, 50% after March 1st. We need to block up the dates. And beware, and this is probably relevant for all international classes, your US passport. I don't know why they put expiration day of July 1st when it really needs to be expired 6 months. They will, if it expires in the next 6 months, they won't let you travel. So just beware, you really need to be not only up to date with your passport, but have 6 months to go with. And in Peru, it would be really ideal to get that yellow fever vaccine at the travel clinic at Tulane, because Loreto does have yellow fever. Next one. And there's some potential funding opportunities for Latin America that you might want to look into. That Stone Center Tinker Foundation, Stone Center often requires a research project, but if anyone is interested in coming for the course and then staying to do a research project, they should also talk to me because we would need to start doing an application very soon. But that is a possibility. We have that project on the ground in Iquitos that we can kind of find a role for you to play if you come to Peru. Next one. That's it. That's it. Lizzie, who's on this call right now, she's a doctoral student right now. She attended the course last year, and so she can also answer any questions. And I just also want to say again, is that living here, I veer as needed, and we have definitely a structure for the class, obviously, and a syllabi, but I also try to make sure that we highlight some of the things that you all are interested so that you leave feeling like, you know, you got your passion topic addressed. That's it. Thank you.
Great. Thank you so much, Dr. Paz-Soldan. And we are going to keep moving with the Sierra Leone course with Dr. Lena Moses.
Hi, everyone. I just wanted to talk a little bit about the Sierra Leone program. We also have Dr. Celia on the call who runs the actual course, Dr. Remy Landry as well, who is co-instructor, and the program manager, Aaron Lever, on the call as well. So you can switch to the next slide. So Sierra Leone, I think, is a really interesting place to hold a study abroad. It's Sierra Leone's a very warm and welcoming culture. The advantage is if you don't speak another language, English is the official language. But this is an infectious disease Trop Med course, and we have there's a high burden of infectious diseases there, and so a lot of this is a lab-based course, and so a lot of the specimens that we collect that we use in the course are actually locally acquired. It's also recognized uh, particularly well internationally for the robust public health surveillance infrastructure. And it's just a great place to go out and shake every once in a while. So Tulane's had partnerships in Sierra Leone since the 1990s. The School of Public Health has, and with Jala University, where we actually host the course since 2012. And so we do help place students with APEs if they're interested in it. We also have two adjunct faculty that are based in Sierra Leone, that are Sierra Leonean, that are very active in this. And we also have linkages to a lot of public health agencies and community-based organizations in the area. Next slide. So I'm going to turn it over to Dr. Celio to talk about the course in detail.
So welcome everybody, and Remy, you can back me up. So this is classes TRMD 6340, same class that I teach here in the United States. Right now I only teach it in the fall, but this is like a shortened, same class, but in a shorter period of time. So you would do 12 classroom sessions, pretty much be all day. You have the morning session where we do our theory presentations, and then we'd work in the labs in the afternoon. You can see here's Joseph here in the lab with us. So these students, we did this class about 2 years ago with the Sierra Leonean students, and actually worked really well. Here I am lecturing, and here we are drawing some blood. That's actually Lena drawing blood, but okay. So this is our last day on one of the classes where it's a Friday. We're all wearing their traditional clothing, and overall, it was a wonderful experience for the students. We just like we do here, we do micro first. We'll be doing actually growing plates, dealing with organisms. And then from there, we go on. Dr. Moses will be doing sessions on PCRs and ELISAs in resource poor settings. And we also go on and do learning how to do a CBC, a differential, how to do a malaria count, parasite count, thick and thin differentials, looking at urine. So it's pretty much basically the same course that I teach here in the United States. Remy, you want to add anything?
No, I think that's it. If you go to the next slide, Robert, I think we have more of what is covered.
Yeah.
I'd say the only other thing that we incorporate into the course is some site visits to a clinical laboratory, the national laboratory. So these are kind of field trips that to give you an idea of how the laboratory system integrates into both public health and clinical care there.
And that is true. We get last time we had some urine and what was actually positive for, I forgot now. But yeah, so we have we get the samples from Sierra Leone.
I think next slide. So the course is scheduled from July 20th to August 1st. It'll be primarily in Bow. We have an excursion planned to the capital, Freetown. And so this, as Dr. Celia said, this is a very intense course. And so normally she and Dr. Landry teach this course across an entire semester. And so we're condensing it into some long and intense days. I think the other thing that is unique and why we decided to choose this course for Sierra Leone is because of the partnership we have with Jala University. They identified that this is a course that they need, and so we're trying to be good partners here to integrate into this. And um, we work and with faculty at Jala, and we also have masters in public health students from Jala University that are in the course as well. And then we have an excursion at the last bit of it to Freetown, where we can tour the National Public Health Agency laboratory there and hit the beach. Next slide. So program costs are $2,150. And so you can see the breakdown of what that entails. We don't include the flight, visa and airport fees. Food is quite inexpensive, so I think it varies greatly depending on how much you eat, and then any kind of souvenirs and things like that. But the transportation, accommodation, is covered in that course fee. Next slide. Next, yeah. So here's some key deadlines, and then the team. So if you have any questions, please contact Erin Lever or Remy Landry. And thank you, Robert, for putting this together.
And I think it's also, a side point, a very good experience for students of public health to be working with the public health students in Bow. I think it's a very good collaboration.
Great. Thank you all so much. Everyone is staying on time too, so very much appreciated. All right, we're gonna keep things going with Dr. Nancy Mock. Take it away.
So hopefully I won't lose a minute by getting all in here. Robert, could you advance to the student testimonial? Because instead of telling you what the course is about, actually, you can hear it from a student from this last summer.
Yes, hopefully the audio will work. Let's give it a shot.
Doesn't seem like it is, huh?
Mm-mm.
Let me see if I can troubleshoot this real
There's a
quick.
closed
Maybe if
caption,
you-
so we can at least read it.
Yeah, maybe if you keep your microphone on while it's playing.
Okay, I'm gonna keep my microphone on and turn my speakers up.
I'm here with Liz Wyoming, wrapping up the end of our course. There are so many things that I enjoyed from this that I didn't anticipate, from just being with a mixture of people from different programs at Tulane, to the intentionality and the thoughtfulness of our instructors and their selection of our speakers. We have learned practical skills of cleaning a wound, to meeting with tribal health leaders to see what innovations they have in providing healthcare and increasing accessibility. And even the readings themselves, I find myself constantly trying to categorize different types of leaderships, environments where I've been, in a disruptive environment. I think it's also very, very timely course, right? We are in an environment right now where things have been upended, and this course overall has given me hope to know that there are avenues that historically others have taken, and it's sort of like our responsibility now as leaders to think about how we can continue to advocate for those around us to be creative and to not do it alone. So I'm super excited to be here and hope this supports too.
Thanks, Robert. And if you don't mind going back to the first slide, that'd be fantastic. Well, this is the only non-international course. It's based in Du Bois, Wyoming, which is a town about 70 miles east of Jackson, Wyoming. It's 50 miles from the Grand Teton National Park. The ranch itself, the Double Bar J, is a ranch that's nestled in the mountains about 30 miles from the Grand Teton National Park. So what the purpose of the Wyoming experience is really to immerse you in one of the key goals of sustainable development in terms of protecting the environment. And there's no better example of the need for protecting our environment than this area around the Yellowstone ecosystem. So a lot of the field trips actually involve hiking and again, hiking, you don't have to be a serious hiker. Walking might be a better way to put it. In these environments in Yellowstone and Grand Teton, so a lot of the field trips are about that. Now, this disruption issue really, is the second part. And obviously, everybody is well aware of the disruptive and the complexly disruptive environment that we're living in. And it's really a two-edged sword for public health leaders. On one hand, it's very challenging, right? All the political, economic disruptions. But on the other hand, there are opportunities through technology to address really important public health leadership problems, particularly that of providing quality healthcare in rural settings, and therefore disruptions that can lead to transformation of rural health systems. So a lot of the course and the field trips also involve visiting rural clinics and tribal clinics and learning how disruptions are both being used and areas where, and students explore areas where they can be better leveraged to transform rural health. Rural health service delivery being a very, very key challenge in the United States and all over the world, actually. And so the course really is immersive, heavily experiential. And one of the final projects of the course is a student's own plan for developing their leadership skills to operate in this disruptive environment to help transform our health system. And next, please. So this is the course specifics. It runs from June 28th. We ask you to be there by June 28th. The course actually starts on Monday, the 29th, and it ends on July 10th. We also are, if we didn't end up doing it last year because there was not demand, but we also are poised to offer a 3-day intensive experience in either Yellowstone or Grand Teton, either hiking or kayaking. So this is an optional piece to this class that we have not yet offered, but we're ready to offer if students are interested. Next, please. Yeah, so ground travel and lodging fee is $1,800, and this covers lodging, study trips, most meals, and ground transportation. We're asking students to register by April 15th. And as I said, there's an optional 3 to 6 day wilderness adventure. If you're interested, you need to let me know as soon as possible because organizing it does take some logistical work. The The venue is a ranch. It's a relatively rustic, but quite nice ranch on the about 10 miles outside of Du Bois. It's beautiful. It's remote, and it's 8,500 feet elevation. So usually coming the day before it leaves allows you to get acclimatized to the elevation. The ranch also sits right next to Shoshone National Forest, which offers numerous trails. So you can hike from the ranch as you like. We take you on a number of guided expeditions. Next, please. We've done that one. And so I'm really going to be brief, but you can find out a lot more about this course through either scanning this QR code or going to the link. You'll hear a lot more in the way of the student testimonials and material about the course. So that's it for me. Thank you.
Beautiful. Thank you so much. And I'm going to stop sharing because Dr. Tanya Thurman had her own presentation.
Hi, everyone. Last but not least, and I have to say I'm very excited about all the courses that I've heard about. I wish I could attend all of those. I'm Professor Tanya Thurman, and I'm excited to tell you about our Cape Town course. This is actually the first year this course has been offered. It's an immersive 2-week, 3-credit course, similar to the others. And what it focuses on is teaching students how to design, implement, and evaluate ethical and effective programs to improve the health and well-being of vulnerable children and adolescents in low resource settings. And I want to highlight, most of you have probably never heard of me because I have not been on campus in a while, although I visit annually. I am permanently based off campus in South Africa for the last 16 years. And here I have initiated the Highly Vulnerable Children Research Center, and we have a Tulane International office. And my work is focused exclusively on the course content. I've worked alongside in the last 16 years, US government, NGO implementers, and the local government in doing research and actual program practice for orphans and vulnerable children and children living with HIV and other high-risk children within South Africa primarily, and prior to that before the region. And, we will discuss a lot of the funding was through PEPFAR, and this year's disruptions to those funding will be something that we will discuss. And is also why I have time to do this course that I've been thinking about for many years. So everything maybe works out as it's meant to. But also the quote I have here is something that I will really try to impart on students, and really that, it's the use of our knowledge, including monitoring data and including, practical research and lessons that we get in the field for how we can actually improve the programs that are delivered. So why South Africa? So South Africa is home still to the largest HIV epidemic in the world. As of 2025, there were nearly 8 million people living with HIV. That's about 17% of the population, 1 in 5 people. This does include about 500,000 children living with HIV. And many children have also lost a parent to HIV and other causes. And overall, you've got, 14% of all children have lost one or both parents. And, with the epidemic, this has also fueled multi-resistant tuberculosis, which multi-drug resistant tuberculosis, and it accounts for a large portion of those in the region. But it's not all doom and gloom. I mean, within this context, we actually have some of the greatest innovations for HIV care and treatment and prevention that are used globally. And we will interact with some of those stakeholders who are responsible for some of that, and particularly in disseminating it. So while the lessons learned will be broadly applicable to programs serving vulnerable children, given this context, we will have in my background, we will have a lot of focus on orphans and children living with HIV and other children affected by the HIV epidemic, which includes adolescent girls and young women who are at the highest risk. The course is organized into 5 different themes that reflect key dimensions of this programming. We're going to discuss the setting, the needs, and various guidelines that guide programming for working with vulnerable children. We'll also examine a lot of the different types of approaches from health, education, economic. We're going to emphasize a lot about family and caregiver engagement in the care of these children and adolescents, as well as strategies for participatory service delivery. And we'll also talk a lot about ethics, and there's a lot of challenges, not only in a low resource setting, but in working with vulnerable children and adolescents and partnering with NGOs to conduct your research. And we'll talk about, a lot of the considerations about responsible data use, about consent, and all the real ethical issues that you might face in collecting data in the field. And importantly, we will also consider, this is the kind of stuff that I didn't learn in school, which I've learned in the field, which is those operational realities where we have this beautiful study design we want to do, but yet we have to partner with an NGO and work with them on their targets and their priorities and make it work for everyone while still trying to add to the evidence base. And so we'll talk a lot about adaptive monitoring and evaluation approaches, secondary data sources, indicators that are appropriate for short-term versus long-term impact assessments, and other considerations when evaluating programs for these youth. But I think, you're coming to South Africa, so a main thing we're going to be doing as well is we're going to integrate this classroom learning with hands-on field experiences. Students will engage with, and assess real life programs, and you're going to focus on a lot of evaluations and critically assess them as well. So with that, I'll be drawing on some of my relationships in having to provide an enriching experience. And, we're going to have site visits and guest presentations to observe implementation and engage with the frontline stakeholders. And this will include local implementing partners. We're going to go to community-based organization, an HIV clinic. I also think it's important with a respectable township tour for you to really kind of understand the context that you're working in, particularly in Cape Town, because there's a lot of disparity here and people could come on a vacation and think they're in Europe, but you're not. And so we will try to see all parts of Cape Town in that way. I'm also very excited about some of the people who have agreed to present, including the former South African health director of USAID, former USAID, who has so much knowledge, and I'm excited we'll be able to speak freely with us to talk about some of the dynamics between stakeholders and other local implementers as well that we'll be bringing in and meeting on the field. So, these are assignments actually will emphasize this kind of critical reflection and applied learning. So we will be looking at real life case studies that you will read one before you come. And we're also going to focus on real evaluations, peer reviewed evaluations, and break them down. And we'll also look at the frameworks that guide this actions. And we're going to have a lot of practical examples within South Africa and the region, both in our field visits and in the literature in front of you, which kind of will help us to bridge, this idealized designs, idealized approach, even with a program versus what is realistic to actually achieve. And then, as I mentioned, I think to me, as I've learned in the field, a critical thing is the stakeholder dynamics between donors, NGOs, the local government. And these days we have a lot of funding constraints and how that actually shapes programs and what you're able to do. I want to have a lot of discussions on that so we can also think about the way forward for public health and international public health within the context that we're living in. that you guys are living in. I'm over here. No, I'm just kidding. I'm still affiliated, unfortunately. So grading will be based on 6 core learning assignments. It is an intensive course. So, we will be looking at, we're going to have a literature digest. This will be some pre-reading, not a whole lot, but I do want you to come to the ground or come here knowing a bit about South Africa, knowing a bit about the target population that we'll be talking about so that we can dive in. You'll also be reflecting on our site visits. You'll have prompted questions and kind of a journal type thing. So to help you to assess your experience and how it relates to your interpretation of how you would respond and these kind of situations or improvement of programs and other things. And then we will also, all of us we'll have a real case study, a document. Again, this is something you'll read before you come. And this will be a large focus of your course in terms of how would I improve this program? What are the strengths and weaknesses of this actual program that's been going on? And then that also builds into your donor pitch when you're trying to get additional funding, because I think, it's critical that we learn how to engage with a range of stakeholders versus, both in explaining as you will, an evaluation and a technical point of view, but also talking to a lay audience and convincing them, or a lay public health interested audience, such as donors, and convincing them of the value of your ideas. So we will be doing all of that over this 2-week course. And lastly, in my little marketing is that I do recognize that, particularly as graduate students and investing this kind of money, that you are, while you obviously want to be intellectually stimulated, you want to have a great experience. So I will just highlight, if you didn't know, that Cape Town is amazing. There's a reason I've stayed here for almost 20 years, and it is consistently listed as one of the top 10 cities in the world. Well, I don't want you to do it now. This QR code will take you to the website to learn more about it. And, just to, reasons for that is because it's just absolutely gorgeous here. It's literally at the tip of Africa and offers breathtaking sea views and beaches. Some of them have penguins on them and just fantastic landscapes and incredible winelands. I enjoy those quite a bit. And then for those that like the adventure, there's certainly a lot of those adrenaline type of activities here as well, in terms of zip lining and paragliding. And while Western Cape Town area is not known for safari, there is still the opportunity to see some animals within an hour or so of the city. And then we also have the whale season happening starting in early June, July. And I've never been a fan of the shark cage diving, but that is available year round as well. But I think most importantly is that there's incredible people, many of whom you will get to interact with and learn more about. And so now that I've hopefully piqued your interest, I'm going to cover a few logistics. The course is occurring June 8th to the 19th. We will have the weekend off. My schedule is not 100% because frankly, it's hard to lock people down to do something in June on certain dates this early, and especially in South Africa, which was closed for all of pretty much December and January. But we will be having a final itinerary come through, but I'm envisioning kind of 4 full days where we're all out in the field all 4 of those days, 6 half days, which may be the classroom based, but also having guest speakers. We do start early in South Africa around 8 or 8:30, particularly for traffic as well. We also have a later lunch. We do lunch at 1 o'clock. You will have the one weekend where we won't have site visits, but I'll give you some optional things if you'd like to do it. Similar to other classes, it costs $2,500. It includes accommodation. We have actually gotten a good negotiated rate, which actually everyone will have their own single room. It includes all the transport. We'll get you from the airport, and we're going to get you to all the sites. Most of your meals, breakfast and lunch, except for on the weekend, you'll have to get your own lunch, but we'll make up for it with a couple dinners. And your other costs or your tuition, I need to follow up with you, Robert, because I was under the impression that they also had to buy their own international health insurance, but we'd like to hear more about.
We can
Great.
discuss. Also, sorry to interrupt. I do want to save some time for Q&A. We have about 5 minutes left, so just a heads up. All right, thank you.
And then, well, the last thing I'll just move on to is unfortunately, while I was asked to promote this, we are at maximum capacity right now of 12 students that are enrolled. However, they do have until February 16th to drop out. So I ask that you write me, and my contact information is on the next slide, that you write if you're interested in being added to the wait list. And I can make that spot for you. It's probably just the enthusiasm about the first year that we're starting. So with that, and hopefully we'll be offering it in future years as well. So with that, this QR code has my contact information. You can feel free to reach out to me if you have more questions, or again, if you'd like to be added to the wait list, which we, again, final enrollment, we should know if that's available in the next 2 weeks. Thanks, I'm done.
Great. Thank you so much. All right. Well, I appreciate everyone for participating. This was an awesome opportunity to showcase all of our courses. Does anybody have any questions now that we have everyone here?
I have a
Feel
simple
free
question.
to.
I'm
Go
sorry.
ahead.
Hi, my name is Alexis Kador. I was wondering, once we've selected the course that we are wanting to take, do we follow up with you all, or do you get a notification saying, hey, such and such has enrolled, and the approval process goes from there? I'm wondering about the follow-up process after we've selected it.
Yeah, so I don't want to speak for all courses, but you will need instructor permission to register. So that would mean following up with the course instructor or the program manager. So unless anyone else has any other input, any of the course directors has any other input, I would recommend following up directly with them to let them know of your interest in registering.
Okay, thank you.
Anybody else? Great. Well, I will be sharing this recording with everyone, and I will make sure to have the communications team send this out as well. So for anyone that was unable to attend, we can still use this as promotional materials for all the courses. So great. I appreciate everyone participating in this, taking their time out of the day and putting together a presentation. So hopefully we'll get momentum and be able to do this moving forward as well for years to come. So thanks everyone, much appreciated. And we'll be in touch.
Hold on, before you hop off, I actually
Oh,
did just
yeah, go ahead.
something. Okay, so for the course fee, is the course fee in addition to our traditional tuition, or is this like our tuition that we'll be paying?
Yes, it is in addition to tuition.
Okay, all right.
Mhm.
That sounds good.
Thank you all. Take
Bye.
care.